What is going on, everybody? Today I'm at Denver Sports Recovery and we're gonna be following Dr. Morgan Dahlstrom. Woo! Woo! She is a sports PT here at Denver Sports Recovery where she treats people and athletes of all walks of life, all different sports, all kinds of good stuff. So we are gonna be going through a day in her life and showing you what a sports PT does. You ready?
I'm ready.
Let's do it. All right, we are now inside of Denver Sports Recovery with Dr. Morgan. Is that what you go by?
Yes.
Okay.
Morgan is fine too.
Okay.
Yes.
But I like the doctor part. It's cool.
Nice.
Okay, so now we're inside the treatment area where you treat patients, yeah?
Mm-hmm. Yep.
Okay, so walk me through like how you prepare for your day.
So I usually get here like 15 to 20 minutes early, and then I'm just looking at my whole schedule for the day, and I'm pulling up each patient's note and reviewing,
Okay.
when's the last time I saw them, the exercises I currently have them
Yes.
doing, and then their conditions, like a couple of them today are post-op, right? So
Okay.
I'm looking at their post-op protocol and where we are in
Got
that,
it.
and preparing for everything that we need.
Got it.
Yeah.
Cool. So we'll go through her little prep process and then we'll see the first patient.
Exactly. So first one we have Dylan, he was a former gymnast and acrobat, and he has some chronic neck pain that he's going through. So we're gonna treat that one first, and then the next one, chronic low back pain that we've been treating for a while. She's doing really well, so hopefully we're progressing into more like functional strength stuff right now, which is my favorite thing to do.
Nice.
Next one we have some shin splints. She's a triathlete slash aspiring runner, but hasn't been able to run for a long time consistently because of these shin splints. She ran track in college and since then has had these issues. So also more of a chronic issue, but we're trying to treat her really functionally. So today we're gonna do like more of a strength program for her, which is so fun. That's my favorite thing to do. And then the last one's also a triathlete, and he's dealing with like bilateral Achilles tendinopathy, also chronic, right? So probably also gonna get more on a strength program for him too, but that's an initial, so we're gonna start from the bottom.
Okay.
Yeah.
So you enjoy doing the strength elements to add it in. Okay.
Yes, yeah, so I was like, that's the more fun stuff, right? When anything's like really acute, it's okay. We just have to do a lot to like get the inflammation down, get them to tolerate activity a lot more. When we can get into like, more of like a foundational strength program, targeting things that probably caused these things. I'm like, that's my bread and butter. That's what I want to do all day, every day.
Okay.
Yes.
Yeah. Tell me a little bit about like your weekly schedule. What does that typically look like?
Yes. I'm here 5 days a week. So I'm here 9 to 5 Monday through Thursday, and then I'm here 9 to 1 on Fridays.
Okay.
My appointments vary a lot. We have a lot of different options. So I can do either an hour long or a 45-minute long evaluation. Right? So like the initial evaluation. That one really just depends on how complicated it is or if they've been seen before, right? Because if it's, like an easy example, again, like an ankle sprain, 45 minutes is plenty, right? If it's more of like a chronic back pain, they've seen 3 chiropractors, 2 physical therapists, and 2 orthos about it, and I'm like, I'm gonna want the whole hour, but my default is probably 45 minutes, and then my default follow-ups are 30 minutes. So usually in that 30 minutes, on average, it's 15 minutes of exercises, right? Either reviewing or modifying their program, and then 15 minutes of manual therapy, which is cupping, scraping, needling, soft tissue work, joint mobilizations, whatever they need. But I usually like the max I see, like yesterday I saw 14 patients, which is pretty high. We also offer like 15-minute dry needling appointments, so sometimes when I have a lot of like those little appointments, it can add up. I probably average seeing about 12 a day on my long days, right? So like 6 to 7 on my half days.
So are there any like typical manual therapy things that you find yourself doing more often?
Yes, this population loves dry needling. I probably needle 80% of my patients every day. And it's one of the only things where we can get like into the muscle belly, right? Like if I'm doing soft tissue stuff, I can probably get the same release. It'll take me like 15 to 20 minutes to dig into this muscle, whereas if I can just poke it with a needle and it'll release, we're like, great, get on out of here, we're good.
Love it.
But then a lot of times, like on the back is probably where I mostly do cupping, right? Because that's probably where we'll get most of the reaction from it. I've done it when people like don't want to do or have done a lot of needles lately. I've done that like on a quad or on a hamstring type deal. Scraping is probably one of my least used ones. I use that on tendons, right? So more so like an Achilles tendon, a quad tendon, a patellar tendon, hamstring tendons, where I just can't like, needling itself can be used in tendons, but it doesn't get that big jump release as it would in a muscle belly, right? So if a patient's just feeling a lot of that tightness in the tendon, I'll go for scraping. Other than that, I mostly just use my hands and do some deep tissue work, try to do some like trigger point release type stuff. It's a love-hate relationship, but it's very helpful.
Well, so now we're waiting on your first patient.
Waiting on the first one.
All right.
So his paraspinals are basically like overfiring right now. So when I tested low trap and lat, the paraspinals both acted up too on the right side. So we're gonna try to add in some exercise where we can get those specific muscle groups to work without the paraspinals tapping in.
Got it.
Okay, because yeah, his paraspinals seemed like to go into spasm, and then it flared up the whole spine, so then he even got like upper traptitis on the right side. So we usually have been treating a lot of chronic neck tightness, which was very overactive but weak SCM, sternocleidomastoids of this one. This one was definitely very different because he had like a flare up of his paraspinal muscles, more at like the lower thoracic spine, so lower mid back. So we were treating, his lats weren't quite as flexible and movable on his right side as they were on his left side, so his paraspinals were trying to take over.
Okay.
So we were trying to treat extensibility and trying to strengthen in a length and range, so a lot of eccentric lat control with like the lat pullovers and then the kettlebell pullovers this way. Yes.
Walk me through like the steps that you went through.
So ask him what's going on, ask him how the next step feels, and then he reported back all the flare-up stuff that was more related to down here. So then I took him through a whole movement screen, seeing how his neck's moving, seeing how his back's moving, and then feeling the muscles as we're activating different back muscles.
Yes.
And that's where I found what's overactivating and what's underactivating.
Yes.
So then we went to strengthen those to prevent that from happening again. And then we talked about posture positions too, so it doesn't constantly flare up throughout the day.
Okay, there you go. And then you send them the kind of exercise they need to do on their own.
Exactly. So I send like exercise videos, sets, reps, and frequency. I send it in an email within 24 hours of the treatment.
Yes. Yeah. What's next? Who's the next patient?
We have a chronic low back pain patient who's been doing pretty well. Last time she came in, she had a flare up. She got sick and then things like exacerbated a little bit after not being able to do her exercises. We calmed that down a little bit. Hopefully today we can progress the exercises again because we were getting into like really fun and hard glute and low back strengthening stuff. So hopefully we'll do that today.
Okay.
So I'll take her in, she'll sit down, she'll tell me how like the update is, how everything's been going.
Okay.
If she's had any flare-ups or how the exercises have been going, especially with consistency. That's one of my biggest pieces. Like, have you been able to do them?
Right.
Great.
That's
right.
important. Yeah.
Yeah. And then usually I either take them through a movement screen or we go through exercises to see how they're doing with them and if they've been doing them right. Okay. And then we can progress them and usually finish with some treatment, so soft tissues, needling, whatever we need. She's doing really well. She's getting a lot stronger. So now we're just working into functional movements, trying to get her to learn how to hinge, to not be afraid of hinging, because the initial injury was probably a disc bulge. It was so long ago that we didn't actually know, right? But it was just turned into more of a chronic thing. So initially we didn't want to hinge at all. We didn't want to rotate. We didn't want to put a lot of pressure on the disc. So now that she's healing and doing really well, we're trying to work back into those patterns. So like she said, she can do laundry and bend over and twist and play with her kids without being afraid of that movement. So yeah, working into hinging. Gonna work into squatting next visit, mostly doing a lot of glute stability stuff and core stability stuff. Yes. Yeah, we needled her L5 and her S1 multifidi on the right side, just the L5 on the left side, and then we did the glute meads on both sides. Right, just to alleviate some of the tension, because when I felt her low back, the paraspinals and the erectors on that low spine were really tight and tense.
Cool. All right, y'all, she's got a little break in between patients here, but back-to-back action there. You are jam-packed on the schedule side. So let's talk a little bit about your background then. and how you like got into PT. What made you want to get into it?
So much. I thought about being a PT when I was probably 12 years old.
No kidding. Okay.
Yeah. And it was kind of one of those things I was like, I'm going to be a PT, and I did it, and I was like, great. But I did it because I was in PT a lot.
Okay.
So I had like bilateral patellar tendinopathy for a long time, so a lot of jumpers or runners knee type pain. And I was in PT probably did 12 weeks of PT 4 times.
Okay.
And it didn't really ever get better.
Okay.
Yep. And when it actually did get better is when I joined a CrossFit gym.
Okay.
Yeah. And I was like, oh, I just need to strengthen.
Yes.
Right? So I think
training.
my quads were sore for probably like a year straight.
Yeah.
But I was like, great. So they were just really weak.
Yeah,
right?
okay.
And I think that kind of made me angry that I was in so much PT and it never got better.
Yes.
Right? So
Yeah,
when I was
sure.
going through LPT school, I'm like, there could be solutions to this, right? And then I played basketball all the way through college at University of Southern Indiana.
Okay.
Never had any knee pain really again, right?
Awesome.
Which was awesome because we strength trained the heck out of it.
Yes.
And I went into college already being strong, where all the other girls were like, what are weights?
Yeah.
Right? So that was fun.
Yeah.
And then after that, I honestly am just a nerd and I really like school and I like learning. So after grad school, I was like, or after college, I was like, I think I'm just going to keep going to school.
Yeah.
Right? So then I got into PT school.
Okay.
I've been out of PT school. I graduated in 2021. So I've been out of PT school for 4 years now. My last clinical rotation was at a place in Texas called Exos, right? Which worked with a lot. It was so cool. Worked with a lot of like NFL athletes.
Yeah.
And then a lot of like pro, high school, college, all those kind of athletes too. And I was like, I need to work with athletes, right?
Yeah.
And I did a couple like neuro-based clinics too, and I was like, these are awesome, not for me.
Right.
Right?
It's a whole different world.
Yeah, right? After my first job, I was like, 1, I want to not work in insurance, and 2, I want to work with athletic, motivated people too. So then, when this job came along, I was like, absolutely. And now, when I work in Denver, I work with so many athletic people. Runners, triathletes, endurance athletes, climbers, weightlifters, the active parents and adults, right? And it's just so fun because people are so motivated.
Yeah. I think that's great. I mean, I think a lot of people that get into PT, especially that have athletic backgrounds, want to work with athletes.
Exactly.
So somebody who, you got like the internship at a very cool place that does athletes, and now you're working at a super cool place, it's Denver Sports Recovery, that has a lot of athletes coming through. What would you recommend for people that want to go that route and want to work with athletes?
Yeah. When I was doing the same route too, they recommended you go through a residency, like a sport, to be essentially a sports physical therapist. So it's a sports certification specialist, it's a SCS. I didn't do that. One of my really good friends did, and she's awesome. That will take you into being more of like in the athletic training room type, right? So like being with a team. Right? So they do a lot of on-field coverage, which is awesome. I wanted to be in a clinic that people come to me and I don't have to travel a ton.
Different worlds.
Exactly.
Different worlds, different schedules. For sure.
Yes, and different skill sets, right? Like a lot more acute care versus chronic or more rehab type base what I'm doing. So honestly, it was a lot about connections, because when I got that clinical rotation, which I had to apply for, that was when like right out of school, right? And she knew a lot of people who were in sports specific clinics.
Got it.
Right? And then just trying to be in an active place. Right?
Totally. That helps.
Because I did some clinicals, in like middle of Illinois, suburbs of, or kind of middle of nowhere, South Carolina. There was not a lot of active people, right? But like a city like Denver and like even a city like Chicago, Seattle, LA, like all those places are going to have such high population of people who are motivated and want to be in sport, right? So that's probably my biggest piece of advice.
Right on. You're a doctor of physical therapy. There's a lot of, especially in Denver Sports Recovery, a lot of different providers like chiropractors, athletic trainers, all these different people. Like, tell me the main differences between everybody and what makes like PT its own thing.
Its own genre.
Yes.
In our setting specifically, physical therapists and athletic trainers overlap a lot, right? So my coworker next to me, we do a lot of the same things here. Our background is just very different, right? So she was a athletic trainer at CU for a long time. So she is basically like really good at acute care coverage, really good at being on the field, keeping players on the field and court. Whereas we don't get a lot of that training, right? We don't get a lot of the acute care. We're first responders, but not really in that kind of setting, right? So our training is a little bit more neuro-based and a little bit more rehab-based. We're really good at like treating the long-term effect of it, right? So maybe a little bit more, I guess just rehab-based is the best way to describe that. And that's kind of like, the biggest blur, especially at DSR ourselves. We also have chiropractors, massage therapists, acupuncturists. We have a couple other athletic trainers that are in here part-time, then like a muscle activation specialist. They're all good at like rehabbing the body, right? And I think people know chiropractors pretty well. They adjust the spine, but they could do a lot more than that, right?
Yeah, they do a lot of like manual therapy stuff too,
right? So our chiropractors, at least 2 of them, can dry needle, right?
Yeah.
So I'd still put them in the treatment-based category,
Okay, got
right?
it.
So they'll do adjustments, they'll do cupping, ART, like, what is that? Active release therapy. There we go. Scraping, needling, all that kind of stuff too, but when it gets into rehab, I know like James will do a couple of exercises here and there, but it's a comprehensive rehab program.
Got
They
it.
get sent to me.
Okay, that's the PT. Got it. Okay.
And then obviously massage therapy and acupuncture, all different kinds of realms, but still very like treatment based.
Got it. Treatment based versus like a rehab based.
Exactly.
Long term. We're trying to like, you're trying to like figure out, I mean, there's clearly if there's an acute issue, like something's hurting.
Yeah.
But there's something causing it.
Yes.
So it's like, let's figure out what's causing it. Let's come up with exercises too that are going to strengthen areas that might be related. Yeah. Okay.
And a lot of times, even in our treatments, we do a lot of like manual therapy techniques first, just to calm inflammation.
Yeah, that's always helpful.
Right?
Just to feel better when you leave.
Exactly, right? I'm like, we just need to get you feeling better, and then we'll deal with how to actually fix it from coming back the next time too, right? So that's a lot of where they come in as well. Most people who come to DSR see multiple providers at once, right? A lot of them will start at the chiropractors and then get referred to us, and then we'll refer to muscle activation technique, all that kind of stuff. Which is also what makes this place so cool, is that there's so many different mindsets.
Totally. Yeah. So in the whole like recovery world, like I mean, a lot of things have become more popular. Let's say like cold plunges or even just contrast, sauna, cold plunge, all kinds of stuff. Do you think that there's any like overrated like recovery tool right now?
Good question. Well, I've always kind of thought foam rolling was overrated.
Foam rolling, okay.
I still do it.
Okay,
right? Because foam rolling is not going to fix anything, right? It's going to feel good in the moment. It's going to help you, maybe perform better. Think of it as like a warm-up at a gym or before your sport event. Yeah. But people have been coming to me with like IT band syndrome. Like, I've been foaming my head, it's not getting better. And I'm like, well, that's not your issue. So I'd say that'd be my number one. But I still do it in order to just help increase blood flow. And
it can help you feel a little better. Like, what's wrong with trying to feel a little better sometimes?
Right? And I'm like, if you just want to dig into something, great, right? It's just my problem is when people think it's going to cure things. Right?
There's usually like an underlying issue that they're not looking at.
Exactly. Right. But in terms of all the other recovery stuff, no, because they're all kind of along the same lines, where they're going to increase blood flow, right? They're going to help decrease DOMS, right? 2 days later.
What's DOMS? Tell people what that is.
Delayed onset muscle soreness. There we go. And there's been a lot of studies on like vibration therapy, like that cool Swiss swing that I showed, right? On how that is proven to decrease DOMS 2 days later, right? So it'll help you be less sore, which will help you perform better, right? So all that stuff is basically going to be under the same umbrella. It's just going to be like kind of what works best for you.
Got it. So now, next patient. We're on to the next.
Here we go. Our next patient isn't in a lot of pain, but she is a very active person. She bikes, she weightlifts, she hikes, she climbs. She just can't move her right hip like she can on her left hip. Okay. Right? So it seems more a mobility issue of the hip, as in her passive range when I move it is pretty similar to her active range, right? So the mobility itself is not great, but it's also a stability control issue, because if we change how her trunk moves on top of her hip will move better. Yes. So we're going to reevaluate it today, see where she is after the first round of exercises, and then see where we can progress them to. She did great. It was a lot more muscular control rather than the actual hip mobility. So we did the banded hip, world's greatest, just to open up the hip joint itself. But it was mostly trying to get her to rotate her torso over her hip that improved her hip range of motion by like 10, 12 degrees. Nice, awesome.
So like what sport or activity are you involved with?
Swimming, running, and biking. Triathlon.
How has coming to see Morgan helped you with your sport?
Honestly, I've always been a runner, and I've always had shin problems, lower back problems, and some knee problems.
And I've seen other people, but no one's ever really given me like a dedicated schedule of, okay, do this twice a week and this is how you should be doing it and this is what it should look like.
Yes.
So the pain got so bad that finally Morgan wanted to help me out. And so she has been, and she's given me like a full regimen, and keeping up with it has already helped. And yeah, I'm excited to actually feel good.
Have you already seen any improvements from it?
I'm running farther than I could before, so yes. And with less pain. Leah has a lot of shin splint pain, right?
Yes.
Hers is a little bit more like posterior tib tendinopathy now. She has had stress fractures in the past. So now we're working on a lot of global strengthening the whole body, right?
Okay.
So as you saw, we're working on a lot of glute strength.
Yes.
She also has low back pain, hip pain, right? All that kind of stuff, knee pain. So we're trying to get her to feel her glutes when she's doing workouts to avoid arching her low back so that she's not getting so much excessive lordosis, so she can actually target the glutes.
Yes.
And then we're trying to stabilize her glute med so single leg stance isn't as stressful on her ankles.
Okay.
Also while strengthening her calves.
Okay.
Strengthening the whole lower body essentially. So her we wrote a whole program for. We didn't do any manual work. We just tested a bunch of things, saw what worked for her, what didn't, and then I'm just gonna write out 2 days of strength per week that she'll stay in that block for like 4 to 6 weeks and just changing up the rep scheme as we go.
Got it.
Yeah.
All right, last patient of the day.
Ollie has chronic Achilles pain that he's been dealing with for a long time that took him out of running for a point last year. Right now it's not really limiting him with running, so he's just trying to get ahead of it. So this was an eval, so we did a whole body evaluation and just kind of see how everything moved. He walks with external rotation of both hips, so he kind of is toeing out.
Yes.
We found that, his hips don't like to internally rotate, especially worse so on the left side than the right side. They need to be able to internally rotate in order for him to get proper push off, right? So he's compensating with his lateral gastroc, the outside of his calf, to try to get that push off when he's running. So we're gonna try to fix that patterning and then strengthen the medial gastroc, so getting him to use more of the big toe to push off.
Yes.
So he's not just constantly using the outside of his foot and wearing out the outside of his shoe. Yeah, so we use the dry needling on him to release the outside of the calf because those ones were really tight and overworked, so he had some nasty trigger points in there. Got those to release, which should hopefully take pressure off the Achilles tendon when he goes on his run tomorrow. And then the exercise should help him fire up the inside of his calf a little bit better.
All right.
Yeah.
Awesome. That was an extremely full day. And that was her half day. Like that was a legit half day, back to back to back to back patients.
Yes.
What keeps you going? What keeps you wanting to do this?
Honestly, my patients here really do, because they're so motivated that they just want to do all the things that they love to do all the time.
Yeah.
So my other jobs and clinicals that I've done, it's like pulling teeth, trying to get people to do their exercise, and they come back, I'm not better. And I'm like, did you do anything?
Yeah.
So this job,
Did you do it?
so this job, when I give people exercise, they're like, I did them every day.
Yeah.
And I'm like, okay, great.
Yes,
and then
awesome.
we see progress a lot faster with that too, which is really nice. And it's also, I don't see patients as frequently in this job, right? So I see them probably like once every 2 weeks, right? So I kind of try to help to put myself in their shoes, right? When they're coming in like for 30 minutes once every 2 weeks, trying to get everything out of it, right? I'm gonna try to be my best self and help them the best way I can.
Absolutely. Overall, what do you like most about being a sports physical therapist?
Same answer, probably, right? I was like, just the patients I get to see. I meet a lot of really cool people too, right? Like, it's not only the athletes I get to see, I just see people who are like business owners who have come from really far away, who aren't from here, right? So I just get to talk to a lot of different kind of people, and the connections I make with that is really cool. But also just seeing people happier because they're out of pain pain.
Totally.
Yeah.
What about what's your least favorite part?
Well, standard answer, the documentation.
The documentation, the patient notes.
The patient notes.
Yeah.
Now that I'm not insurance, it's not really that bad.
Yeah.
Mine's more exercises, right?
Yeah.
So after each patient, I take the time to write down exercises, write down some of the cues we went through, and I attach mostly a video to them.
Yeah.
And then I email it to them. So that after today, it won't take me super long, but like on a full 9 to 5 day, I'm here for maybe 1 to 2 hours extra finishing
Got it.
that.
Okay. So yeah, that's a piece that
Yes.
not everyone gets to see.
Yeah.
Yeah.
Yes. And I go through 20 exercises. I'm not going to expect you to remember all of these.
Yeah.
Yeah.
Totally. Well, cool. So then, Morgan, if people wanted to come see you, where can they find you online?
DenverSportsRecovery.com. You can also call our front office, which you can also find online too. But our front desk is awesome, and they're also really accommodating. We have a ton of options at DSR too, so if you're not even sure where to start, feel free to call them, have a conversation with them. And then you can book directly with me, Morgan Dahlstrom, as a physical therapist online too.
Okay. So guys, there you have it. That was a day in the life of Morgan Dahlstrom, a sports physical therapist here at Denver Sports Recovery. So guys, if you like the video, give it a thumbs up. Or if you want to come see her, go check her out at Denver Sports Recovery. But don't forget to subscribe to the channel, hit that notification bell so you don't miss any upcoming videos. But guys, thank you so much for watching, and thank you, Morgan, for letting me follow you around for the whole day. It was a good time. I learned a lot.
Yeah.
And actually, I think a good takeaway here is from the whole experience is what I've noticed, and you can tell me what you think, is strength.
Yeah, always.
Strength
Yes.
is such an important component of everyone's life.
Preach from the choir here.
Yes.
So yes.
Get strong, y'all. See you in the next one.